Joining me here in our visual radio studio to talk a bit about back to school and health concerns, Dr. Preston Herrington is here from San Juan Health Partners Pediatrics. Welcome back to KSJE. Good to have you here.
Good to be here.
Thank you for being here. Also, Erin is here. She's a nurse practitioner with San Juan Health Partners Pediatrics. Welcome to you as well.
Thank you.
And you haven't been here in a while.
It's been a while.
Erin, we were talking because you were in a whole different job last time you were here. So it's good to have both of you here. And Dr. Herrington, let's start with you a little bit about what types of things you're hearing about these days. What's the buzzword in your field?
Well, you know, the big news for 2019 has been the nationwide measles outbreak.
Right, right.
We can thank some of our anti-vax friends for helping to facilitate that. But,
right.
You know, measles is extremely contagious, and if you get a critical mass of unvaccinated kids, then it can kind of spread like wildfire.
Which is what we're seeing, right? Is it,
Right.
At least maybe not wildfire, but fire. It's spreading.
Right, it's spreading, and you know, I think Erin knows the statistics better than I do, but it's been kind of a bumper year. For decades, we haven't had this much measles. And,
right.
Fortunately, not that much in New Mexico, but.
And I guess that's a good thing. But Erin, again, what are you hearing about? And I know as people travel, that then even if a state or a region doesn't have a big maybe outbreak, that travel can bring it back to you.
Definitely. So just in the last January to August of this year, there's been over 1,100 cases in the United States affecting more than 30 states. And in our general area, we have actually had a couple of cases reported in Sierra County, which is Las Cruces. That was back in May. And then Arizona and Colorado have had multiple cases as well. Of those almost 1,200 cases, about 10% of those individuals did require hospitalization for complications such as pneumonia and encephalitis, which can be very serious, of course, and even result in death. So.
Yeah. And so that's the problem, I guess, right? When you have some of these vaccinated populations coming in contact with the unvaccinated populations and these things spread, Dr. Herrington?
Right. And you know, the measles vaccine is very good, but it's not perfect. So occasionally somebody who is vaccinated is still vulnerable. But we rely on something called herd immunity, that if enough of us are vaccinated, then if a percentage of us the vaccine didn't take, we still will be protected. But if you get enough people who have measles exposed, if you're unvaccinated, you're guaranteed to get the disease. But even among the vaccinated, you have a small chance of getting it.
Right. And so is there such a thing as herd non-immunity then with the group that doesn't have the vaccine?
That's interesting. I've never heard of herd non-immunity.
Well, leave it to me to come up with a new term. But I imagine if you have a lot of these folks that don't have the vaccine and they contract measles or can spread it, then that's the problem, right?
That's the problem, right. And some people are either the babies that are too young to have received the vaccine, or they have leukemia, and so they're vulnerable. So it's not just a healthy school-age child who, even as Erin said, can be sick enough to have brain damage or be in the hospital. But particularly bad are the very young or people with underlying illnesses. Right,
and that's the issue, that if you're not vaccinated, you put those other folks at risk, I suppose.
Right, and some people who choose not to vaccinate have not thought that through, and they think they're just making a decision for their own child, which is in some cases is correct. Like, we can talk about it. There was a case of tetanus in a child who never got any shots. Well, you don't get tetanus from other kids, you get tetanus from the dirt. So you're not really making me in danger by not getting vaccinated for tetanus. But for measles, yes, because if you get it, then you spread it to dozens of people.
And so I guess the question for both of you is, if you have a parent that comes in and is thinking about maybe not vaccinating their child, or maybe only certain vaccinations, or do you have a speech that you have ready for them, or try to explain to them what the point is? I suppose the power rests with the parent.
Yeah, a couple things. Our office is in the process of developing a policy where people who don't want to be vaccinated, we won't continue to keep them as our patients, and that's to protect the patients that are following our recommendations. But my approach has been through the years is to try to have a conversation. Some people just have some misinformation that I can clear up. Some people are true believers in the cause, and it doesn't matter what information they get, they're not really interested. Some patients have a question about only one vaccine but not others.
But you have a conversation with them, it sounds like, right? Erin Tinker, same question, same type of thing. Do you try to talk to these patients and get them some good information that they can at least hopefully digest and understand where you're coming from?
Yes, definitely. I try to figure out what it is that's causing them to not want the immunization in the first place. Like Dr. Herrington mentioned, sometimes it's misinformation, sometimes it's fear. A lot of times it's what they've seen in the media that really doesn't have any scientific background behind it to support their decision. And oftentimes people are able to receive the facts and then decide to immunize. And then, like Dr. Herrington said, some people just, no matter what you say to them, they're not going to change their mind on that. So
right. And I'm shocked to hear you say the media would present false or wrong information. I don't know what media that could be, but
some other media.
Some other media. I hope it's some other media, because
Yes.
here we are talking about the correct information this morning. And but I know a lot of folks rely on Facebook or the internet and some maybe less than reputable websites to get their information. I suppose that is something we're always fighting against, even those of us in the media, because folks should see something that was on Facebook or on a website, and that has to be true, even though it's not necessarily true.
right.
And you both have to fight that, I suppose,
Yeah.
not with measles or something, anything else, I suppose.
Right, you name it. And I've become more and more impressed with what they talk about confirmation bias that we all have. So when I see something that reinforces something I already believe, then I latch onto that. And if I see something that questions something I believe, well, I'm likely to reject that.
Right.
And the internet and social media is just a perfect storm for letting you select and reinforce what you think you know, and making it difficult to step back and say, well, what if I was wrong?
Right. And that's hard for some people to accept, I suppose.
Yeah, I think so.
If they are. But you hear that all the time, I'm sure, both of you, dealing with patients and others. And so I imagine for both of you, too, you're constantly doing research on trends and new studies and things like that to, again, confirm or not confirm what you're telling people, right?
Right. In general, we have ongoing
Yeah.
medical education, and sometimes it continues. Like there was a study. I think maybe last year I mentioned the Danish are just
I
amazing.
love Danish. We're talking about the people, not the pastry. I'm
right,
sorry.
right. No,
But they're both lovable things. Yes, sir.
When we talk about obesity, we're going to have to eat fewer Danish.
That's true. That's true.
But the Danish have a kind of a uniform population that doesn't move, and they can track them all. And so there was a study with about 600,000 kids, just looking at the MMR vaccine and the rate of autism, and it continues to confirm that there's no link between MMR and autism. So,
And MMR, again, for those of us that
that's
don't know.
the measles, mumps, rubella vaccine.
Thank you. But there's been that stubborn rumor, right?
Right. That was the original. Andrew Wakefield was the fraudulent doctor, it turned out, that kind of set that out 15 years ago or so, and it's been looked at, but
It's been debunked over and over again.
debunked,
Yet
and it still seems to pop its head up every now and then.
Right. So here's another new, modern piece of research with a pretty big sample group, 600,000.
Right.
That's
His study had 12 kids.
okay.
So and it so there was all kinds of problems with that. It was interesting as a hypothesis, and I'm glad that the way science works is that you look at it, you don't just reject it because it offends you, but the more you look
Sure.
at it, the more you see that it just wasn't correct.
That's the definition of science, I suppose, isn't it? Or one of them, or close to it.
I think
anyway.
it's important. Science is self-correcting. Hopefully, you
Right.
Isaac Newton thinks he's got it figured out, and along comes Einstein and says, "Well, there's a couple things you didn't have figured out."
That's true. Interesting. But so here's another study that again confirms that there isn't really a link between this vaccine and autism.
Correct.
And I imagine you still have parents that think that there is.
Or they say, "Well, I've heard that." The rumor just won't quite die
Right.
down. Yeah.
And that's stubborn, I suppose.
Yeah.
Aaron, same thing. I imagine you hear that a lot too, and your interactions with parents and patients and things. This rumor that's been around for, I don't know how long it's been, a decade at least, hasn't it?
Or more, I
or
think.
more.
I don't remember what year that came out. It may even be 20 years by now.
Okay. But yeah, is there something that, again, just ask folks to look at the research and some of the newer information that's out there?
Yes, and something else I've heard from many parents is, oh, what's the worst that's going to happen? They get a rash, and so that's what they associate the disease as, only being a rash, and it can be so much more than that. And also, especially with measles, it can be contagious for 5 days before to 5 days after that rash even develops, so something to consider. And as you were saying earlier, in highly populated areas, say airports, places like that with travel, a person could be coughing and be transmitting these droplets that are infected with it, and it can hang out for a couple of hours. So you may not be sitting next to someone that you know is coughing, but you could still be exposed to it. And so for those people who are unable to immunize themselves due to age or what have you, or they're immune suppressed, that just puts them at even higher risk.
And that's really the issue, I guess, too, is that
Correct.
that's the folks that just can't help to protect themselves and rely on the rest of us to kind of protect ourselves so they don't have to worry about it as much.
Right.
It's part of that herd immunity that Dr. Herrington was talking about.
Correct.
So, see, there you go. What else has been going on, Dr. Herrington? You got a lot of back-to-school kids coming in to make sure they're ready to go?
Right, it's the time of
This
year
is the
where
week.
School starts this week. Or
Right,
the end
yes,
of this
it
week.
is.
And so sometimes the athletes are just now realizing they need a physical, and so we get a lot of teenagers, kids who are going off to preschool or kindergarten. If they're over 4 and they haven't been vaccinated, they'll be knocking on our doors too. And we don't yet have much illness in the community, so it's a good time for us to try to get people caught up on their wellness exams.
That's good. Always good. And again, for some of these student athletes, I know sometimes you can screen for potential problems or issues that may not even be fully aware. And we always hear these tragic stories of these kids that are great athletes and they seem in perfect physical condition and then they collapse and have some type of a problem. And so
Yeah.
these things you can kind of look for while you're doing these checks.
Right. That's in my mind. That's the big thing you want to try to pick up as somebody who's at risk for a sudden cardiac death. Clues can be in the family history, or if they say, well, yeah, every time I sprint I get lightheaded and almost faint, questions like that. Sometimes our agenda, if the child is healthy, their agenda is to get the form signed, and we also just want to have a conversation, and we have confidential conversations with a lot of the teenagers to find out if they're involved in substance abuse or if they become sexually active, other things that where we can make a difference to hopefully keep them as healthy as they can be.
Right. You're not just being nosy. You have reasons,
Right.
medical reasons for asking these questions, correct?
Exactly.
And they can lead to other, I guess, conditions that you would want to be aware of to look for or screen for or what have you.
Definitely.
Is what we're talking about. So you mentioned that we're relatively healthy. That means we survived the flu season, I guess. And so how was that this winter and spring in San Juan County?
My recollection, the winter was relatively light. We have several viruses that come through, and pediatricians have our own perspective that we're looking at the ones that affect the children most. But influenza is a big one. Prior to that, we usually have a croup season, and then after influenza or overlapping with it is RSV, one of our number one bugs that will make kids coughing and wheezing and that sort of thing. And this last winter was not too bad.
Well, that's good. Good to
Right,
hear.
right,
Any
yeah.
projections for this winter that you've heard?
I have not heard, although we sort of have a sense that if you have a light winter, then maybe the next winter will make up for it and we'll be busier. So I don't know if that's urban legend or if that's really going to happen.
Gotcha. And you mentioned RSV, and is that's some type of respiratory something?
Right, respiratory syncytial virus. It's not a very catchy name, but I
Okay,
guess
which is why it's called RSV.
right, exactly.
There you go.
And that's been around or been identified for multiple decades, and it's probably the number one virus that puts kids in the hospital, little babies, and occasionally if they have underlying heart or lung problems, they may even be in the ICU, be
I
pretty
see.
sick.
And is that similar to whooping cough or different?
It's different. It's a virus for one thing, and whooping
Okay.
cough is a bacteria.
I see.
And we have a vaccine for whooping cough, which we don't have for RSV yet.
Got it.
But they can both be serious.
And I think I hear about whooping cough too, seemingly every winter as well. Is that something that pops up from time to time?
There's always a little bit of whooping cough, also known as pertussis, kind of running around in the community, partly because the current vaccine, the history of the vaccine is such that originally there was a whole cell vaccine where they just chopped up pertussis, and it worked pretty good, but it had some side effects, and so then they came out with a cleaner, more purified version, but that new vaccine, which we use now, it doesn't last as long, and so you'll have kids that have had the vaccine a few years ago, and they may still pick up whooping cough or pertussis.
Gotcha. And for most kids, though, I mean, if they're relatively healthy, it's just a little bit of an inconvenience, or can it land them in the hospital?
I would say most kids, it's a cough that takes forever. The Chinese call it the 100-day cough.
Okay.
And it's like you have to grow a whole new lining of the inside of your lung. Now, if you're a baby and you're coughing so hard that you can never inhale, sometimes you end up on oxygen or even on a ventilator. And, I think the very elderly, if you already are walking around kind of borderline oxygen and you get something like this, it could make you pretty sick.
Gotcha. Understood. My guest this morning from San Juan Health Partners Pediatrics, Dr. Preston Herrington, is here. Also, nurse practitioner Erin Tinker is here as well. We're talking about some of the issues that are going around with the back-to-school season and just what kids are facing these days. And I know you mentioned the Danes and the Danish, and that leads me to obesity because we want to talk a little bit about that. And so it's not necessarily the Danish's fault from Denmark, but it's the Danish's fault from the bakery that we're talking about. So I'm afraid, are we still, as Americans, getting fatter?
I did see a study recently.
I'm doing my best to help that statistic. So
they were looking at preschoolers, and that the rate of overweight and obesity among preschoolers is starting to drop. So
good.
So
okay.
The pendulum may be swinging back.
All right.
I think most of my patients have gotten the word that they should not be drinking sodas and juice on a regular basis. They should be drinking water. I think that's a big chunk of it. And then I think we all know that we should be physically active. The electronic entertainment is so alluring that sometimes it seems boring to just go out and take a walk when you could be playing an exciting video game. But
right. But that's not the cure to obesity, I suppose, right? Or the treatment for obesity.
Exactly. Yeah.
So that's good news, though, that those stats are showing maybe some of our younger people being thinner.
Right. Yeah. There may be a kind of a wave coming of less obese or fewer obese kids as they come up through school. That
could be good, because then that maybe solves some of the other health problems that are related to obesity, right? With other health issues like heart problems and respiratory problems and joint issues, I suppose, if you're heavy.
Yeah, I think, and of course, Erin, since she's a family nurse practitioner, knows more than I do about this, but the adults, we see the early stages of it, but a lot of our patients into their 20s and 30s will develop diabetes, high blood pressure, heart disease. All these things kind of go together, and so we want to, of course, set them on the right track so that they're still healthy, multiple decades after they've graduated from our practice.
Sure. So. Erin, that sounds like a segue to you a little bit about some of these issues when we talk about obesity, but what do you see with young people and parents maybe trying to get their children a little bit thinner and healthier and starting those habits early, which is really important?
Definitely. I think one of the most astonishing things to me is how much time kids spend on screen time, whether it be their cell phone, video game, TV, etc. So I've had a lot of patients doing their back to school checks, and I always ask, well, how much screen time do you have every day? And I, expect we want 2 hours or less. You kind of expect to hear maybe 3 or 4. It astonishes me how many kids say, probably 8 or 9 hours a day. Granted, it's summertime, so they're not at school.
Right, but it's like a full-time job.
Right, and I think, well, what are you doing the rest of the day other than being on your phone or whatever? So,
and probably not much is the answer, right?
Exactly. So establishing those healthy habits early. We all understand the draw to be on Facebook or to be on social media or be video gaming, TV, etc., especially when it's hot outside. But, just setting limits on that and having healthy times and
or watching people like us on YouTube. I'm sure the kids are all tuning into us right now.
Exactly.
Yes.
They'd probably be more excited if we were opening little prizes or something.
Probably.
That seems to be a big draw to little kids as well. But,
interesting.
Anyhow, so really just kind of cutting back on that. School contributes to that in some ways because a lot more homework is being done on computers and things like that. But really setting limits for the amount of time we're spending on those things and getting up and getting out and doing more. It's hard to do when it's really hot outside or but it's good to have those healthy habits ingrained early so that we continue those on and don't make excuses quite as easily when it's hot outside or things like that.
Sure. And again, if you are unhealthy as a child, chances are as an adult, it's hard to turn things around, I suppose is what I'm trying to say.
Right. Better to prevent it than have to treat it after the fact.
Right.
Sure.
And again, diabetes and some of the other things that we were talking about, I imagine heart problems and joints and whatever. If you're trying to carry around an extra 50 pounds, 100 pounds, that can't be good on your joints and
definitely not,
and things like that. So, but hopefully things are getting thinner. Kids are getting thinner and hopefully healthier.
Right.
Overall.
Yeah. Hopefully this is not just a fluke. But
fingers crossed.
But if it's the start of a new trend, then that's good news.
That would be good news. That's very true. What else? I think we want to talk about ADHD. That's another buzzword that we hear a lot about with children these days, right? Which is attention deficit hyperactivity disorder, right?
Yeah, I saw an abstract a few months ago that This is not surprising, and I think it's not the first time that this has been noticed, but it says new study links screen time to preschooler behavior problems and ADHD symptoms. And I see this in the office, kids who are still in diapers, but they're entranced on their parents' phone, playing the games better than I could. They can navigate the phone better, and I hope that it's just a rare thing that they use when they're out in public to keep the child from misbehaving. But what this looked at is if kids are spending more and more screen time, that there's a correlation. And of course, that is not necessarily a causation, but there's a link between that and behavior problems and ADHD as they get older.
Interesting. Okay.
Yeah.
And what do they recommend then? Just obviously limiting that screen time and
Right.
making sure the child has other stimuli, I suppose?
Yeah, I think the reading with your kids and being physical and playing the games that we all played growing up, I think, is good common sense. Yeah, another editorial I had seen somewhere was that it's not just the kids, but if the parent is on their phone and the child is trying to engage them, and the parent is just like, "Don't bother me right now, I'm on Facebook," that's a concerning
Sure.
trend as well. That
True.
The parent is really the child's looking to connect with their parent.
Right.
Is the screen becoming sort of a babysitter? When we were younger, there was worry that people were using television for that. They just parked the child in front of the TV for hours, and I think now it's all of the screens.
The computer, the iPad, the
Right.
cell phone, whatever it is, smartphone, kind of replaces that a little bit, and so that is an issue. And so, with that being said, as you see some of this stuff, how much do you feel you as a physician can talk to these parents if you notice something like that?
Yeah, you can have
to
a
be a little
conversation.
careful?
And, I think it's part of the art of medicine is knowing if somebody's receptive that day, or if they've been up for 3 nights with a sick kid who's been crying, and
Sure.
maybe you make a note of it and talk about it at the next wellness exam. Some people really connect to us and really seem to want our advice. Sometimes they're just there, just treat my kid's ear infection and
Let me get out of here.
right.
I suppose.
Let's not go off on some rabbit trails. So.
Got it. I guess you learn that pretty quickly as you get into practice, the timing.
Yeah, and sometimes you don't. You think somebody's
Okay.
interested in
Right.
a conversation,
Well,
and
that's
you can tell they're looking at their watch, or they're not really in
Sure.
the conversation anymore. So.
Right. Erin Tinker, I want to kind of come to you a little bit about that sixth sense, if you will, about knowing when is a good time to bring up something to a parent about their child and maybe about what they can be doing at home. Do you kind of learn that fairly quickly, at least most of the time? There's always maybe a misfire, but does that come fairly naturally?
I think so. I think, like Dr. Herrington said, kind of watching the individual that you're speaking to and see their body language and cues that they may be giving you. Also, what are they there for? If it's that well child check, it seems a little more appropriate to spend more time on those health maintenance and preventative type things versus the ear infection that we want to be in, out, and on our way and back to school or back to the game or whatever it is that we're doing. I think a lot of patients, the parents unintentionally, like he was saying, they're on their phone, and so the child is trying to engage them and they dismiss the child because they're busy. And we have to kind of go back to that old adage that our actions speak louder than our words. So we tell the child we love them, we do things with them, but when we're constantly putting them off to do things such as the phone, then we can't be surprised when they're more engaged in the phone and not wanting to talk to us, which teenagers generally are more guilty of that than the younger kids. But I've even seen quite a few younger kids in the office that their parents talking to them and they don't look at them, they don't pay any attention because they're so engaged in that game or that video or whatever it is that they're doing. So
Right, and it's so easy to do. I think even
Yes.
for all of us. I know even when talking to friends, I sometimes find myself looking at my screen and just not, yeah, sure, and that's not the best way to communicate as a
Right.
communicator, and so I get that as well. As we kind of come into our final moments here this morning, is there anything folks should be watching for as the year wraps up here, Dr. Herrington?
Well, I think the flu shots will be available soon, and
Right.
I think this year we'll also have the nose spray available. I always tell people if you get to Halloween and you haven't had your flu vaccine, that's a good reminder if everybody's out with their costumes and stuff, that get your vaccine, because flu will typically come after the new year, but oftentimes it shows up in December, and you need a couple weeks head start between the vaccine and being fully protected.
And once you get it, though, then the vaccine will protect you for several weeks and months, correct?
Right,
I mean,
right.
it should last through the season,
Through
should
the
it not?
season, right. In fact, if we knew, the reason you have to keep getting revaccinated is because the strains change a little bit each year. So, unlike measles, once you're vaccinated, measles is the same as it was 100 years ago. Well, last year's flu may not be the same as this year's flu, so you get a new flu vaccine because you want to have the best match for the strain that we think is coming.
Right. And again, that's also another thing where I guess the CDC is working on what strain they think is coming to get enough vaccine throughout the country by
Right.
fall, winter, I suppose, right?
Right. It's always an educated guess based on what's going on in Asia and what's going on in the southern hemisphere. And of course, there's influenza A and influenza B, and then subtypes of both of those. And most of the typical quadrivalent vaccine has 2 versions of A and 2 versions of B. Best guess to protect us. And some years it's a really good match. Some years the match isn't quite as good.
And this may be an ignorant question, but it makes sense that they just can't build a vaccine with everything in it, like a super vaccine, and just
They're working on that.
inoculate me for everything, and whether it's swine or avian or any kind of flu, and I'm good to go.
They are working on sort of a universal flu vaccine.
Okay.
That if you could be immune to the part of the flu that doesn't change year to year.
I see.
And so far, they're still working on that. So
Gotcha. And I imagine the side effects from some super vaccine could be
that's what you have to
difficult
look at,
as well.
Make sure that you don't make somebody feel worse.
Right.
Turn out worse with the vaccine than without it. So
Right. But the regular flu vaccine is not designed to do that. It's designed to keep you healthy from whatever strain of flu is coming around that winter,
Correct.
that season.
Yeah.
That's what we're talking about. So,
Yeah.
very good. Erin Tinker, any final thoughts here as we get into our final moments this morning of anything for folks back to school and kids, and just, again, make sure vaccines are up to date, I suppose?
Yes. I think those are all good things. Get your well child check before the winter season comes along so you're not around as many sick kids.
Right.
And get your immunizations for sure.
That's important as well. And do your research from reputable sites.
Right. The CDC has a lot of good information, and that's for medical people and for lay people and all different levels of reading. So,
That's a pretty good site.
yes,
All
definitely.
right. Dr. Herrington?
and then, the American Academy of Pediatrics, the American Academy of Family Practice, Center for Disease Control, they link to each other, and then they also link to, like Erin was saying, to reputable sources and information.
Okay. That's better than Dr. Bob's blog on the internet somewhere.
Right, exactly.
Okay. Very good. Good information from both of you. Thank you so much for coming in this morning.
Sure.
Thanks for having
Thank you
us.
for having us.
You bet. You're very welcome. My guests here, Dr. Preston Herrington, also Erin Tinker from San Juan Health Partners Pediatrics. My guests here on KSJE. I'll be back with more in just a moment.